Dynamics 365, powered by the Healthcare Accelerator, is helping Medicaid care managers easily manage their population, ensuring they're helping their members achieve healthier lifestyles. In this demonstration, we're going to go through the persona of a care manager, and we'll see how she's able to quickly pull up newly enrolled members, filter by risk score, review the member 360, schedule in-home assessments, complete assessments offline from any device, co-author the care plans, and initiate and follow up on relevant services. Let's get started. As I log into my care management solution, simple queues can be configured for teams or individuals, and it allows me to easily see newly assigned members. When I click into David Aaron's record, it takes me to this cohesive view of the member, where I see relevant alerts, as well as any disease risk ratings related to previous programs that David might have been a part of, as well as any clinical information such as procedures, medications, appointments, or even care plans. Now that I have a complete view of this member, I'm ready to give them a call. And the first thing I can do is verify their identity using a HIPAA verification process where I capture a member ID number, maybe even social security number. In addition to that, the system serves up relevant next best actions. And this one, to schedule an LTSS home assessment. Scheduling is actually easier than ever using the seamless integration between Microsoft Office and Dynamics 365. With one click, I'm able to both schedule and attach the appointment to the member record. A few days pass, and now I'm in the home of the member, ready to begin this LTSS home assessment. What's great, though, is that entire member record is accessible to me, so I can see any medications, conditions, or appointments that were completed since the last time we spoke. With one tap of my finger, I can begin the assessment process by pulling up the right assessment. These assessments can be powered by clinical guidelines like MCG, as well as being automatically filled in from previous assessments. What's also great is that they're dynamic, so as I interact with the assessment, additional questions are served up to me in a relevant manner. The system also has the ability to combine clinical guidelines with machine learning to automate scoring, such as this PHQ score. Now that I saved that, the appropriate care plan has been added to David Aaron's record, and I can tap into that to view it. The system is smart enough to recommend the appropriate problem, goals, and interventions, but I, as a care manager, have the ability to configure that as well. When I tap into this particular goal, I can see all the details around it, as well as the associated interventions, and make any adjustments that I feel are needed to this particular intervention. Working with the member, we co-author this care plan together, and I can capture their consent and agreement right within the application. All of that's saved for me, attached to the care plan, as well as can be created into a PDF that I can print or email to the member. Thanks to the offline capabilities of the solution, I know that when I get back to self-service, all this information will be updated automatically for me to move on to my next appointment. Spending less time updating assessment notes gives me more time to focus on services for my members. Service plans can be grouped by chronic conditions, for instance, and when I click into that, it gives me a lot of details around the start date and the end date, but also the related services such as food, mental health, or even transportation. In this case, we know David Aaron needs help with food delivery, so I can open up that service request. At the top, I'm taken through a step-by-step process that allows me to move this request through the necessary steps to complete it. Now, I can fax off a service request or a call, but in this case, I've got an integration directly to Aunt Bertha's website, which empowers me to search for the appropriate food service vendor, find one that works for this particular member, and then walk through the steps of setting up that vendor for services. As I follow the steps in the process, I do check in with the member and come to find out they need to extend services. So with one click of my mouse, I can renew those, and it's added to the overall service plan. If I need to make any adjustments, that's not a problem. I can just simply click in, make the edits, and save the record. Dynamics 365 helps Medicaid care managers improve member health by empowering them with clinical risk modeling, offline assessments, and service plan management.